Hey guys, the other day I asked if you might have any questions, and I got a number of cool questions, but one in particular really caught my eye, so I wanted to go over it first. The question was, what do you think makes a good doctor? And I'll generalize that to a good healthcare provider. I wrote down the first five things that came to my mind, so I wanted to share those with you. I'm sure that I'll think of several more as soon as I'm done recording, but the first thing was that a good provider should care deeply about people. Now, might seem kind of obvious, but I don't think that this is something that can be taught. I think it's probably a characteristic that compels most people to go into medicine. And it's a characteristic that will cause you to think about patients long after you leave the office, that will cause you to lose sleep some nights in the course of worrying about a patient or their condition. And it's a characteristic that will maybe lead you to make a call on a Sunday just to check in on someone. So this is something that I've struggled with myself, dividing professional from personal. But I think it's just one of the most important things. The second thing is that a good provider treats the patient with the disease, and this is based on a William Osler quote. He said, "A good doctor, a good doctor treats the disease. A great doctor treats the patient with the disease, or the person with the disease." That really spoke to me. We have to remember we're taking care of people here, not conditions. The third thing is that a good provider should focus on education first and foremost. And I think this is becoming more and more challenging as our visit times become more and more compressed. But if the focus of the visit between a provider and a patient is education, the patient will have a much better understanding of what's going on with their body. They'll have a much better understanding of how they can actively participate in the treatment process. So that's critical. The fourth thing is that a good provider should be an eternal student, meaning they should always be seeking more knowledge. They should always be learning more. The more you do learn, the more you realize how much there is out there that we just don't know. So it really is an eternal quest. And the fifth thing is that a good provider would be okay with asking for help, would be okay with admitting they don't know something. And this is oftentimes challenging as well, because people routinely look to us for advice and they really rely on us. But I think that being okay with telling a patient, I don't know the answer to that, but let me reach out to someone who might, or let me do a bit of research, get back with you. I think that's such an important characteristic. So those are the first five things that came to my mind. Let me know what you think makes a great provider.